All right, good morning, everyone. It is Wednesday, May 27th, 11:30 a.m. Our first order of committee business for today is hearing an amendment and on S64, an act relating to amendments to the scope of practice for optometrists. I'd like to start off with council to discuss the proposal of amendment put forward by Representative Nugent. And there was also another piece she would like to touch on from previous testimony and conversation.
Good morning, Jen Carby from the Office of Legislative Counsel. So if it's all right, I'll speak to the Medicaid issue first and then go into the amendment so we can keep the amendments together.
Thank you.
So I just wanted to give a little bit of an update on this is S64, an act relating to expanding the scope of practice for optometrists. And when I was here last week, we talked some in this committee and other committees about the Medicaid coverage and the Medicaid state plan amendment and whether legislation was needed for that and the timing. And I was reminded of, which I should have remembered but did not, of an existing statute in our health insurance statutes around choice of providers for vision care and medical eye care services that applies to Medicaid and basically says a health insurance plan and Medicaid have to cover the same services, whether they're offered by an optometrist or an ophthalmologist, as long as that provider is acting within their scope of practice and is a participating provider in Medicaid or the insurance plan. And so I reached out to AHS yesterday and said, hey, what is this? Remember this language? And they didn't, because it's been a while since this came up. And so after talking to them, they said they would not, because of this language, Medicaid would have to cover the services that we're talking about in the bill if they were offered by an optometrist who was a participating provider in Medicaid. And they would not need to be directed by legislation to seek a state plan amendment. So we still need a state plan amendment, still need to amend our Medicaid state plan, but the Agency of Human Services would not need legislation directing them to do that because of this coverage requirement. So I just wanted to provide that updated information. I don't think it changes anything about what this committee did last week, but I wanted to go on the record with that because I was operating under the wrong information. And so I shared that with you and I apologize for that.
It happens. There's a lot of moving parts, especially in that portfolio. Good news. Yes. Yeah.
All right, now we will turn our attention to today's order of business, which is an amendment from Representative Nugent that I will put up on the screen and walk you through. It's pretty cool. Nick, can I have sharing access? Still not working. You want me to send a request? Does that help? All right, now it's working. Okay, so this is an amendment that would add a new section. It's not changing anything about what's in the bill already, but add a new section. And this has to do with the Board of Optometry. The current Board of Optometry is 5 members. 3 of them have to be optometrists, and 2 of them are representatives of the public who don't have any financial interest in optometry. And so this would expand the number from 5 to 7. It would increase the number of optometrists from 3 to 4. The way this is written is in existing law is a little oblique, but it says currently 3, this would say 4 of whom shall be residents of the state who have had at least 5 years experience in the practice of optometry in the state and are in the active practice of optometry at the time of their appointment. So to me, that means optometrists. 1 member, and then this would add 1 member who shall be a resident of the state who has at least 5 years experience in the practice of ophthalmology and is in the active practice of ophthalmology at the time of appointment, and then keeping those 2 representatives of the public. So we would go from 3 to 4 optometrists, add an ophthalmologist, and keep the 2 public members. And then it would say, beginning on January 1st, 2031, at least one of the optometrist members of the board shall hold an advanced therapeutic procedure specialty issued under that new subchapter. That's it. Okay.
Any questions for council?
Can
Brooke,
you go to that last sentence on page 1, because I read it and I wasn't reading it properly. Imagine it's one of the optometrists shall hold it. Procedure specialty issue. Yeah, therapeutic procedures specialty issue.
That's
That's what got me.
that's that
I read it
new-
a couple times, I'm like,
I know the terminology is a little unusual, but that's what we called it in the bill, in the underlying bill as well. That's that new subchapter.
okay, that's fine.
Rep. Waters Evans?
I just wanted to clarify, this means that this person, in this last section that Rep. Pincinot was just asking about is someone who's been through the whole training program for all of the new optometry scope.
Yes, or it could be somebody, well, let's see, you have to have at least 5 years' experience in this state.
Yeah.
Yes, I
Okay,
was thinking about whether it could be somebody licensed by endorsement, but I don't think
I read the same.
yet.
okay.
Yes.
Representative?
Who picks the 2 public members?
I have to look at I think they are all, take this down, I think they are all, and OPR may have a better answer for this.
Domina?
I think so, but I want to look before I.
We
are saying
Oh, good.
Yes, we have.
Thank you, Nancy.
OPR joining us.
Jen.
Jen, how are you? Thank you.
Perfect. Okay,
Um,
I'm okay with that.
Preston?
I don't know if this is in the weeds, but because the ophthalmologist really would. By putting them on this board, they would be seeing all optometrists regardless if the optometrist had received the special. Like addition to their licensure or not, or would they only be brought in to oversee cases or?
As written, this would be all.
So they would be.
They would be a
there
sitting member.
overseeing all optometrists, regardless if they have the specialization or not.
That's part of the board.
It's part of the board.
Right, they would be, right, they would be member of the board on equal footing with other members of the board.
Okay, so even if there were only hypothetically 2 optometrists who decided to expand their scope of practice, this ophthalmologist would be seeing the remaining thousands of them. Just want to make sure.
Any other questions for council? I know, Jen Collin is on a short clock, so I want to give her as much time as possible. How are you? Thank you for joining us.
Hi there. Good to be here. For the record, Jennifer Colin, Director of the Office of Professional Regulation. Thanks for having us in today to testify about this amendment. OPR supports this amendment. We think it's a good compromise, and it's a reasonable compromise, and it will ensure that we have the ophthalmology perspective as we implement this advanced procedure specialty within the Board of Optometry. And it's also going to ensure that we have an optometrist with this specialty too. So that's important. And correct, as you said a minute ago, our board members are appointed by the governor. They sit for 5-year terms, and they can serve 2 terms back to back. So folks can serve for 10 years. And, I just want to say also that we really appreciate everyone's hard work on this bill. OPR is really committed to a path forward on S64, and we hope the committee will support this amendment.
Any questions for Jen from the table? Oh, seeing no hands. All right, well, I guess that was 5 minutes ahead of schedule for your cutoff time, so thank you so much.
Thanks, Jill. Appreciate it.
And do we have any other questions for council before I open up the table, the discussion about the amendment itself? Representative Nugent, would you like to say anything about the amendment itself?
I appreciate working with all the stakeholders on this, and I think it should strengthen that relationship that I think is important to exist for this to go forward. You never know in this building, yeah.
I just want to thank Rep. Nugent on the record for bringing this forward because I feel like it's a reasonable compromise. And I know you did a lot of work to talk to all of the stakeholders and weigh the options. It may not be 100% for any one group, but it certainly represents a reasonable path to move forward. Thank you.
Yeah, no, I know. Echoing the sentiment from OPR and we're gonna go, that seeing this refined and having time to understand that it is up to digest it very, well. Does the committee, we could take a position on this now, we could take a position on it later, if people feel like they need time to get a little longer. Okay. So yes, this would be a floor amendment. So we're dropping one, yes. Okay. All right, I guess I will call for favorable thumbs on the government representative. And that looks like a 10-0.
Thank you, Rep. Nugent.
All right, and then we have the emergency management bill scheduled at 1 o'clock, but we might have to push that because we have candidates first up on the floor. So I got to triple check that with the office. So please keep an eye on the text exchange about timing on this. Because my last update was cannabis was going to be the first bill. All right, thank you, everyone. We are getting close to wrapping up the orders of business that are relevant to this committee's jurisdiction. That makes it